An elderly woman who suffered a stroke was forced to wait outside a Melbourne emergency department for 17 hours as the state's hospital system struggles under pressure. The opposition is vowing to make health their main priority over infrastructure, 100 days out from the state election.
The emergency department at Box Hill Hospital in Melbourne's east is under so much pressure, marquees have been erected outside in a bid to help process patients quicker. But in a sign that pressure is showing little signs of easing, an 83-year-old woman has been forced to wait in a tent for 17 hours after suffering a stroke.
If this was your mother, your grandmother, are you comfortable with her being in a tent outside? They wanted to send her back home, and I said that I wasn't comfortable with her, and I spoke to the paramedic about that. And the paramedic said, I would not let your mum go home without a scan.
Our staff are doing the best they can. They're working incredibly hard. This winter has been a winter like no other.
Also in Box Hill, this teenage boy who recently finished 6 months of chemotherapy waited in a hallway for 27 hours because staff had nowhere to put him.
It's my local hospital, so people in my electorate, people in Manningham, from Doncaster to Templestowe, we rely on the Austin and the Box Hill. And what you see is a massive amount of overworked staff. They're overworked. They don't have the resources.
The opposition is vowing to make health their first priority in the lead up to the November state election, promising to shelve Victoria's biggest infrastructure project and spend the savings on rebuilding the healthcare system.
You can't get a train to hospital. You need an ambulance. There's no use having a train seat when you can't get a hospital bed, right? Andrew's, his priorities is to get a train seat and to get a train to get to hospital. My priority is to give you an ambulance and a hospital bed when you get there. That's the choice.
The suburban rail loop is a multi-billion-dollar orbital rail line announced by Premier Daniel Andrews in the lead-up to the 2018 state election. It would be built in 3 stages, connecting suburbs in Melbourne's east and west to the city and the airport.
If you delay it, if you defer it, if you scrap it like the Liberals want to do, it will cost more than it needs to cost. And that'll mean less money for health, not more. Not more. We need to get on and get this done.
In 2018, the government said the first 2 phases of the project would cost $50 billion. But new costings predict the most expensive project in the state's history will cost more than double the government's initial estimate. A document prepared by the Independent Parliamentary Budget Office at the request of the state opposition predicts the first 2 phases would cost $125 billion, even up to $200 billion after accounting for operational costs over 50 years. The Premier maintaining the suburban rail loop must be built, accusing the opposition of having tunnel vision.
The point is, Speaker, you need to do more than one thing at a time in order to even pretend to be the government.
As health and infrastructure dominate debate 4 months ahead of the state election. Julia Bradley, Sky News, Melbourne.